welcome to Solutions for Seniors. I'm Linda Pellerin, the Executive Director of the Shepherd Center of Charlotte. We are an organization for seniors. We use senior volunteers to help other seniors, and our primary goal is to keep seniors in their home environment for as long as possible. And this evening, our guests are with the Mecklenburg American Cancer Society. Is that how it's said?
Just the American.
Oh, the American Cancer Society. And I wanted to have them on the program because, as you get older, you are subjected to carcinogens, really. I mean, just about everywhere we go. And first I should say that this is Denise Hockaday and this is Melissa Wheeler. And really there are, as we get older, I think we're more susceptible to maybe even getting cancer just because we've been exposed to a lot of things. And I have to share with you, I am a cancer survivor. 21 years ago, I had cancer, and I was one of the lucky ones. Surgery took care of it for me. It was uterine cancer. And I'm actually going to get a little graphic. Mm-hmm. One of the reasons that people can survive uterine cancer, at least this is what they told me even 20 years ago, mm-hmm. is because you're literally bleeding to death. Mm-hmm. And that's why I went to the doctor. I'm like, something's wrong. And in surgery was able to take care. I didn't need chemo. I didn't need any radiation or anything. I was really lucky. However, I do have a friend who had uterine cancer a little bit later in life. She'd already gone through her change. And I remember when she told me she had it and she was going in for surgery, I shared my experience with her, and it turned out that they didn't catch hers as quickly as they caught mine because she had already gone through menopause. And she ended up having to have some, some really
different
serious things going on. So, I know there's a lot of inroads. There's a lot of things now that they're doing for cancer patients and everything. Just tell me a little bit about what's going on today with the American Cancer Society. Either one of you.
Well, first of all, thank you so much for having us on the show. You remember when you called and asked us to come, that happened to be my first day at work, and I promised you that I would get up to speed and be on the show. So today's the day, 90 days in. I'm hardly an expert on cancer, which is why I have Melissa Wheeler here to speak from it from a social work perspective. But let me tell you a little bit about the American Cancer Society, because we're one of those organizations that everybody hears us and they feel like they know what we do, and I'm just here to say we do that and probably a whole lot more. I've been just amazed at this organization since I've joined it. We'll be 100 years old next year. And in that 100 years, we continue to be committed to saving lives from cancer. Thank you so much for sharing your story about being a survivor, because it's stories like you that let us know that we're doing the right things right. But if you asked us in a nutshell what we do, we say that we help people stay well, get well, we find cures, and we help people fight back. And that's through a multitude of ways. So yes, the disease has certainly changed over the years, the treatments have changed over the years, and what people need to know is we are right now the largest private funder of research behind the federal government. We do more research than anybody else on all types of cancers. And oftentimes anything we find in one cancer helps other cancers, which is absolutely great. So when you think of us, think of research, but also think of programs, think of advocacy, because we do a lot of that. We're the reason why the Surgeon General tell people not to smoke, because of all the work that we've done and the programs that we actually offer here in Mecklenburg County. So we have 900 offices, we're in 5,100 communities, and chances are you know someone who's been involved in one of our relays. So just a multitude of volunteers and just a great organization. Do you have anything to add to that, Melissa?
I don't think so. I just wanted to comment, you had mentioned about cancer and as we age and being exposed. And as a matter of fact, cancer is a disease that as we age, we are more likely to be diagnosed, and it jumps from decade to decade. From 60 to 69, a woman has about a 1 in 15 chance of being diagnosed. Once we hit 70, that chance moves from 1 to 4. So there are things, though, that we need to be aware of, and that's one of the things that we do with the Cancer Society is talk to communities and talk to people about these are the things that you can do to prevent that cancer diagnosis. These are the things that we can do for the cancer survivors to move on into their survivorship and continue to do well. So that's another significant piece of our role, I think.
Okay, I am a big fan of Dr. Oz, and hopefully I can say that. and I actually tape his program because he's on when I'm working, but I watch him a lot, and he's always, him and there are other doctors out there on TV, and they're always talking about nutrition and things like that. And I know you can go to the American Cancer website, and there are recipes and there are things there for people to stay healthy and everything. But all right, so let's just say, take me for instance. I'm fine now, I'm healthy. What can I do to stay that way as far as like nutrition goes?
Sure. There are several things that would be recommended. One, the Cancer Society offers a dietitian on call program. So cancer survivors or their family members can call the 1-800 number and talk specifically to a registered dietitian about what their specific caloric needs might be, whether they're in treatment or out of treatment, what types of foods to avoid, and then how to look for on labels the best type of food in the grocery stores, because it can be very confusing. I think we hear from programs every day, you should be eating this, you shouldn't be eating that. And I get that question a lot in meeting with patients. Should I have soy? Should I not have soy? What should I have all organic? How organic should I have? We really advocate for you to have fresh fruits and vegetables. Anything that's plant-based. When you go from a plant-based diet, you're looking at your salads, your greens, your potatoes, anything that's a whole food. Those are the types of foods that we really advocate for a healthy diet. So when you make those choices, you don't have to be as concerned about sodium levels, preservatives, artificial chemicals and things in there that might be harmful to your health. So that's one of the things that we recommend in addition to having our dietitian on call service.
Now, what about red meat?
I'm a vegetarian, so that's a hard question.
So am I.
They really recommend that you limit the amount of red meat for intake, simply because there are a lot of other choices out there that are lower in fat for you. I know that there's always been a debate over whether you should have it, not have it. They say that you should have it in limits. You should just limit your intake. And again, the largest portion on your dinner plate should come from that plant base. If you do choose to have red meat, having it, as Dr. Oz says, no bigger than the palm of your hand.
Yeah, and to share with you, my mother-in-law was a big proponent of eating fresh vegetables and fruit and everything, but she liked her meat. And when she was in her 80s, she was diagnosed with colon cancer. And she liked red meat, although in the later years, I'd say the last 5 years of her life, she cut down on a lot of that. But, and I often think, and really, she'd never really gone in for a colonoscopy or anything, to check any of that. And then finally, she was having problems, and that's when they did it. And that's what she ended up dying from. But I often think that it might have been because her whole life, every meal was the base of it was meat. And I've been vegetarian for 15 years, and one of the hardest things when I first went vegetarian, and my poor husband had to come along with me.
I'm still working on that one.
Yeah. But one of the biggest things was, our diet had been, you had your meat, and then you had the things that kind of went with it. And,
potatoes.
Yeah, and for many, many years, I would go to friends' houses, and they'd say, I don't know what you're going to eat. And I would say, everything else. They say, oh, well, we're having meat. What are you going to eat? Well, I'll eat the potatoes and I'll eat the the other vegetables, or I'll eat the starch, whatever. I said, I'm fine, but, and now, are there any specific, you mentioned preservatives, are there any few of them that are on like a list of really try to stay away from these specific preservatives?
They really encourage folks to stay away from trans fats, anything that is, when you see the label partially hydrogenated, those are the kind of things that we try to stay away from. They're chemically altered. They're things that are put into the foods to change how long they stay stable on the shelf. So again, going back to, if you look at anything that comes fresh, anything that you get from that produce section in your grocery store, you don't necessarily have to buy from a produce stand, although Charlotte has a large variety. We're very, very fortunate in our community to have have access to those things, really focusing on the outskirts of the store. When you go into the grocery store, if you can just do a perimeter sweep and go from the produce aisle down to the meats and then up through the dairy, you're really focusing on the things that are going to be more fresh for you, more beneficial. One of the things that you just mentioned was screening. And I would like to, for a moment, just kind of talk about the importance of that, because one of the things that we can do to keep ourselves cancer-free is to participate in our screenings, talk to our providers about what should I be having at this age. You know, it's prevention, and that's really the key. And being an advocate for your own health and feeling confident enough to say to your provider, we haven't talked about what screenings are due for me, what should I have, what can I have? And then scheduling for those things to happen. And if you're fearful, talking to someone else who's had those procedures done, because with those screenings, we have come a long way in terms of cancer treatment and recognizing those things early. The earlier we catch cancer, the better chance we have at recovery.
Now, you talked about screenings, so let's run down the thing. Mammograms for women, how often should they have them? Because I read different reports where they're saying maybe you shouldn't have them every year. Should a woman have a mammogram every year?
A woman should talk with her healthcare provider. The best advice that I can give is to make certain that you have a doctor, a general practitioner, internal medicine, someone that you can seek that guidance from, because those things change every year, and they are the ones that stay on top. They're the experts that stay on top of what should and shouldn't be done. So seek their constant advice and guidance in terms of, what am I due for? What should I have? I always caution people against Dr. Google. And that is the hazard that we all have.
Oh no!
I know.
Yes,
I'm
that's
sorry.
right.
I'm sorry. We all have that tendency, though. You know, as soon as we have an ache or a pain, or we hear of someone that has been diagnosed, we immediately get on the computer. And the hazard that we run with Dr. Google is that there's a lot of misinformation out there. So if you do have questions, go to reputable sites. Cancer.org through the American Cancer Society is a fantastic site to get a wealth of information. The National Cancer Institute has a website where they keep up with all the up-to-date information regarding screenings, diagnosis, etc. So really stick to what you know on the computer in terms of legitimate sites. And just be wary. And if you ever have a question, go back to your provider and say, you know, and make sure to get those health screenings every year. Make sure that you're seeing your doctor, you know. Hopefully you only have to go once a year for that well check, and we want it to stay a well check. So make sure that, you know, just at the beginning of the year when you're doing your taxes, go ahead and schedule that doctor's appointment too.
Well, that's a good point to do that, so you can remember. Okay.
Could I just say,
sure.
also too, it is not, what I'm finding is not certainly one size fits all. So I know you've been focused on diet, and that's certainly a piece of it. We also want to encourage people not to smoke, because you can be a vegetarian and smoke and still be at risk for cancer. Family history plays into this so much. So going to your physician and getting that information about screenings, he has your family history to do that. And then you have environmental factors, where you live, where you work, the amount of exercise that you're getting. You know, at one time we said 150 minutes a week of exercise should be sufficient. But really, in our jobs right now, we're sitting more and more at the computers, exercising less. So that's why we're doing a new cancer prevention study that the community is going to have an opportunity to participate in, to see how all these different variables are affecting this generation. This generation is the first generation that is obese from childhood. That's something very different than the advice that we gave years ago about the link between obesity and multiple cancer. So things are changing in society, information is changing, so your doctor is going to be the best person to be up to date on that information.
Okay, you know, I've got like all these questions. Getting back to the screenings, I just want to say that I'm guilty of this. Colonoscopy, I fought that screening forever. And are they still recommending 55 that you go in for a colonoscopy, or is it even earlier than that?
It's earlier.
They're recommending 50.
50.
Age 50. Unless you've had a primary parent who has had colon cancer, then that gets moved back to 40. And again, it's talking with your provider and finding out. People are very fearful of testing and screening because they don't know what to expect. I always tease that a colonoscopy is the best nap you're ever going to get. You don't remember any of it.
What I was going to say, when I finally gave in, it wasn't the screening itself that I was fighting. It was the process of getting to the screening, because you do have to be thoroughly cleaned out, and there are a lot of different ways. Mine was very easy, and it wasn't the trauma that I expected it to be. So I do recommend that. If you're fighting the colonoscopy, please go ahead and do that.
Absolutely.
And I had an excellent doctor who was just very kind. And you're right, you fall asleep and you wake up and it's over. And
it's very significant with colon cancer because most colon cancers don't have early signs. By the time we actually do see the signs, such as bleeding, it's a much later staged cancer, which makes it much more difficult for the physician to treat. So if we can do those early screenings, if we can just take that quick 30-minute nap and get it over with, we have a much better odds at catching those very early cancer cells and taking care of it.
now the standard is, once you get a screening, is it like every 10 years after that? And I heard somewhere that once you reach 70, you don't need to have it anymore. I mean, is that wrong information or is that correct?
I think there's a lot of debate about
Right now.
There's a lot of debate right now across the board with cancer diagnoses as to when should you stop having the screenings, when is it important to no longer do those things, how frequently do you have to do it. And again, I know I sound a little like a broken record, but going back to your provider, because they have your full scope of medical history. And really your medical history and your family history play a really key role in terms of what risk factors you have going against you. And Denise talked a little bit about the exercise piece and how important that is. That's another thing that we can do to stay really proactive. You know, if we're eating well and we're moving, then we're really reducing our cancer risk.
Because your things are flushing out of your system.
Absolutely, absolutely. And obesity has a large thing to do with what's happening with our cancers. They're doing a lot more studies now in trying to determine that link and exactly why that happens. And people are fearful of exercise. People think, well, gosh, I can't go to the gym. I can't lift, you know, all these weights. It's moving every day. It's finding the things that you love to do, whether it's taking a walk with a friend or your dog, or at work, if you are a working individual, move throughout the day. You know, every time you get up for a break to go get coffee, do a couple of squats before you get to that coffee pot. Every time you're preparing to go to a meeting, or stand up when you're on the telephone, if you're on an hour-long conference call, or you're at home on the phone with a family member, walk around while you talk on the phone.
I like speaker phones.
Yes, absolutely.
They let you move around a lot. I have to share with you that I grew up in a very small valley between two beautiful green mountains in Vermont. But on the other side of that valley was a power plant. That valley, and I don't know if anyone's ever done a study, and I keep telling them they should, because that valley, a lot of the people in that valley have died of cancer or have contracted cancer and have been able to get over it. And I honestly, my uterine cancer, no one in my family had ever had anything like that before. And when I asked the doctors, I'm like, well, what can I do so that I don't get cancer again? You know, this is way back. And I said, you know, I want to prevent all of that. And I said, do you know where this came from? And they said, it was probably environmental. And that's what made me think of that power plant. And it's not, you know, they've shut it down now, but I'm wondering how much stuff is, you know, in the soil and all around there, you know, because this power plant was put online a very long time ago. And it was there as I was growing up. So environment has a lot to do with it, and I would love for somebody to go into that valley and actually do a study on that, because it just seems to me, you know, there are maybe like 1,000 people that live in that valley, and a lot of them have had cancer. But anyway, and I want to get back to, because I said I had a lot of questions.
I know, I see. I see.
I want to get back to, you're saying that, you know, many of us are all, you know, we sit in front of computer screens a lot now and everything. Okay. how is that affecting us? I mean, the whole electronic thing. We're walking around with cell phones to our ears, or you know, earbuds in, and you know, it's like we have our computers now on our person. You know, before, and when we're not on our person, we're actually sitting in front of one. We're sitting in front of the monitor. You know, we have we have all of this electronic stuff just bombarding us. You know, how is that affecting us?
You know, they've yet to really determine a specific link between those things. They have looked at cell phone usage regarding brain tumors before. They failed to find a significant direct link. What they have been able to do is show that our lifestyle of convenience leads to a lack of exercise. That lack of exercise leads to many other conditions in our body that make us more at risk for disease. So that's really probably the most direct link, I think, right now that they've been able to establish, although I'm certain researchers are studying every day.
And I think we're living in a time, it's almost a perfect storm. So in addition to this life of convenience that you talk about, us not moving, our offices we tend to be sitting there, we're eating more fast food. I don't know about you, but I did not grow up eating the stuff that we currently eat now. Kentucky Fried Chicken was a luxury. You had to graduate from high school in order to get that kind of food in my house. Everything was, you know, fresh or frozen. So we're not walking, we're obese. We've got environmental issues going on, and there hasn't been one study that looks at all of those variables. And that's why this cancer prevention study that we're doing, we are actually enrolling 300,000 people across the United States and asking them, if you're between the ages of 30 and 65, to volunteer, if you've never had cancer, to be part of this study, so we could take a look at all of these different situations and what kind of impact that it's going to have on the long term on people's health, and what kind of research do we need to do to make sure that we're overcoming that. So this is kind of historic. We were the ones that found the link between smoking and cancer, and between obesity and cancer, and now we're taking a look at all these factors. So in March of next year in Charlotte, we are looking to enroll between 1,200 and 1,500 individuals here in the Charlotte area to be part of this historic study. So we're hoping that people will hear more about this. I wanted to mention it here, and we will work with the folks at the Shepherd Center to let you be known. And so if you've ever had a situation where you've had somebody in your family with cancer, if you had a loved one with cancer, been a caretaker, had a neighbor, and you felt kind of helpless and wished you could do more than you're already doing, you could be a part of this study. We're asking people to give us, fill out a survey. We're asking you to give us a waist measurement and a little blood sample, and be willing to do periodic surveys over the next 20 to 30 years, so we can look at these very things that you're talking about, how all of these different variable things impacting cancer in our lives today.
Now, is there a phone number that people can call, or I mean, how do they find out more information about this study?
They can call our Charlotte office, or they can call me directly.
Okay, do you want to go ahead and give us the number?
Sure, 704-553-5362.
I'm proud of you, because
it's a new number.
Yeah. I'm proud of you. Okay, and I'm always talking about this. You know, the baby boomers are aging, and you even said, you know, that the chances of getting cancer rise a whole lot, you know, once you're like, what, 70 and up. So the baby boomers are aging. Is the medical field going to be able to handle this influx? And you know, and if obesity keeps going on, and if we don't stamp out smoking, I mean, what's going to happen to the medical industry if all these people are starting to get cancer and everything?
It's a good question. The role that I play with the American Cancer Society is a little bit different. I'm what's called a patient resource navigator. So what I do every day is meet with patients and families in active treatment, try to help them eliminate the barriers to care so that they can have successful treatment and get well. And there is a lack of resources at this point, even for those that we have, you know, right now. We are in a healthcare crisis. We are facing folks with, you know, newly laid off or have been on unemployment for several years and coming to the end of that unemployment.
Underinsured.
Underinsured is a chronic issue. When I first took the role, a lot of the health professionals that I worked with said, well, we might not need you in this clinic. We have folks with insurance. What they've quickly come to realize is insurance doesn't necessarily mean that you have full coverage, full care, full scope of what you need to get your cancer care completed. So I think there is real alarm at what happens as our baby boomers age. What things can we plug in? And that's where navigators have become to play a really crucial role in getting folks streamlined, plugged in, and help them move through that process so that they're successful in treatment. We look at needs all the time, such as medication assistance. Even with our aging population, just because you have Medicare doesn't necessarily mean that everything's covered at 100%. And that's a real misconception. A lot of folks really thought that, well, once I get that age, I'll have my Medicare and I'll be all set, failing to realize that there's a good portion a lot of times that's not covered with surgeries, with hospital stays. There's that lingering 20%. And also medication. You know, if you don't prescribe to that Medicare Part D program, you don't have that prescription coverage, and that can be more money than you're bringing into your house during the month for your retirement check. So we have to really be aware. The best thing that we can do to prepare ourselves is to educate ourselves. What are the needs in the community? What kind of resources will help a person get through a health crisis? Transportation is a huge concern that we have in terms of our folks. Financial need, helping them to keep the lights on, food on the table. Without those basics, then chemotherapy and radiation are not going to make a dent because they need to have those basics first. So we are trying to keep really plugged into what are the needs in our community.
Okay, so let's recap here. We've only got about a minute and a half. So people should eat fresh food.
Absolutely.
And you know, unfortunately, a lot of the seniors buy the canned stuff because, well, they grew up with it, and it sits on the shelf longer.
Yes.
And you know, and to them it's cheaper, and you know, because they don't eat a lot of food and they're afraid if they buy fresh, it's going to spoil on them, and so that probably contributes to the fact that they might get cancer too. But eat fresh food, exercise.
Don't smoke.
Don't smoke.
Ever.
Lose weight.
And if you have a concern, if you have a lump, a wound that has not healed, if you have unusual bleeding, if you have fatigue, seek your healthcare provider. Don't be afraid. Go in, get it checked out.
Well, that's the thing. You know, something will be going on, and they're like, oh, I'm afraid if I go, they're going to tell me this. You know what? Go early.
Absolutely.
Yes. I mean, I did that, and it saved my life, and I will be forever grateful because, you know, I've had 21 years of just wonderful stuff. So, and don't have to worry about all that women's stuff anymore. So, okay, again, give me phone numbers.
704-553-5362.
Okay, and your website is?
www.cancer.org. And then our 1-800 number, that's 24 hours a day, 7 days a week, 365 days a year, is 1-800-227-2345. They're there to answer any question that you have, whether or not you have cancer, anything you could possibly want to know. They're there to assist you.
Okay, great. Denise Hockaday and Melissa Wheeler. I keep wanting to call her Miller. And I didn't, but I mentioned it anyway.
Thank you so much for having us,
Thank
Linda.
you.
Okay, we will see you again next month. I appreciate you tuning in, and please have a great month. Thank you.